1. Which phase of the cell cycle is responsible for DNA replication? A. G1, B. S, C. G2, D. M. Answer: B. S phase. DNA synthesis occurs during the S phase. Rationale: during the synthesis phase, the cell is preparing for DNA division. Cellular DNA is replicated in preparation for DNA division. Protein and ribonucleic acid, RNA, synthesis occurs in the GAP1 phase. Enzymes for deoxyribonucleic acid, DNA synthesis, are also produced in G1 in preparation for entry into the following synthesis phase. Cells are ready for division or mitosis in the G2 phase. Cells in G0 are in a resting phase and are not dividing. The 5 phases of cellular division occur during mitosis, the shortest phase of the cell cycle, and include prophase, prometaphase, metaphase, anaphase, and telophase. Cell cycle. Phases. What happens? G1. Protein and RNA synthesis. S. DNA replication. G2. Prepare for mitosis. M. Cell division. G0. Resting phase. Cell cycle time. Definition: time required for one cell to complete one entire cell cycle. Growth fraction. Definition: percentage of tumor cells actively dividing. High growth fraction. Leads to better chemotherapy response. Examples: leukemia, lymphoma, germ cell tumors. Tumor burden. As tumor burden increases, growth fraction decreases. Tumor heterogeneity increases. Drug resistance increases. Chemotherapy becomes less effective. Number 2. Cells from different organs reproduce at different rates depending on the type of cell. The amount of time required for a cell to move from one mitosis to the next mitosis is termed as which one of the following? A. Tumor burden. B. Cell cycle time. C. Growth fraction. D. Cell cycle phase. Answer: B. Rationale. The cell cycle time is the amount of time required for a cell to move from one mitosis to the next mitosis. Tumor burden is the volume of cancer present. Growth fraction is the percentage of cells actively dividing at a given point in time. The cell cycle phase is a highly regulated 5-stage process of reproduction that occurs in both normal and malignant cells. Number 3. In combination chemotherapy, different agents are used simultaneously. The advantage of combination chemotherapy is which one of the following? A. Combination chemotherapy increases the number of cells exposed to cytotoxic effects. B. Combination chemotherapy increases the opportunity for drug resistance. C. Combination chemotherapy is limited to the recurrent setting. D. Combination chemotherapy is limited to the adjuvant setting. Answer: A. Rationale. Approaches to chemotherapy can vary depending on the tumor type and disease stage. Single agents may be used in certain situations, but frequently, different agents are used in combination. This treatment method is called combination chemotherapy. If cells are in different cell cycle phases, combination therapy will increase the number of cells exposed to cytotoxic effects. With combination chemotherapy, 2 or more anti-neoplastic agents with differing mechanisms of action are used together to produce additive or synergistic effects against tumor cells. The likelihood of drug resistance also decreases. Single-agent chemotherapy is most commonly used in the recurrent setting. Single-agent chemotherapy is more likely to be given sequentially, one agent at a time. Combination therapy is not limited to the adjuvant or recurrent cancer setting. Number 4. All of the following are chemotherapy agents used as radiosensitizers, except for which one of the following? A. Cisplatin. B. 5-fluorouracil. C. Mitomycin C. D. Protein-bound paclitaxel. Answer: D. Rationale. Radiosensitizers make cells more vulnerable to the cell-killing effects of radiation. Protein-bound paclitaxel is not used as a radiosensitizer. Cisplatin is a radiosensitizer used to treat cervical cancer. 5-fluorouracil is a radiosensitizer used to treat rectal cancer. Mitomycin is a radiosensitizer used to treat bladder cancer. 2. Which drug is cell cycle nonspecific? A. Vincristine, B. Methotrexate, C. Cisplatin, D. Paclitaxel? Answer: C. Cisplatin. Platinum agents are cell cycle nonspecific. Number 3. Neoadjuvant chemotherapy is given to A. Prevent nausea, B. Treat infection, C. Shrink a tumor before surgery, D. Treat recurrence only? Answer: C. Shrink a tumor before surgery. 4. A patient receiving dose-dense chemotherapy is most likely to also receive A. Leucovorin, B. Pegfilgrastim, C. Mesna, D. Dexrazoxane? Answer: B. Pegfilgrastim. G-CSF helps reduce neutropenia and supports more frequent chemotherapy schedules.